Good morning, everyone. Thank you all for being here. I want to first thank all of the people who have joined us, and I know we have both Mr. Smiley and Mr. Moores, maybe all candidates. I want to thank them both for being here, as well as my great Councilman Kevin Jackson, who has joined us. And I also want to thank Frank Donahue, the Executive Director of the Rhode Island American Academy of Pediatrics, and Karen Reed, who will share her cautionary story about the dangers of leaving unlocked guns where children play, and I want to thank both of them for joining us as well. On December 30th, 2011, Ashton Melton's 13-year-old son Noah went to a friend's house to play, and unbeknownst to him, when he was there, they were FaceTiming Noah and his young friend, and Noah took out a gun, put it against, Noah's friend took out a gun and put it against his cheek and fired it, thinking that a safety lock was on it. It shot him in the face and killed him instantly. Unbeknownst to Noah's parents, there was an unlocked gun in that house. Now, this is just one example of stories which have happened all across our country, where young people are playing in a home where there's an unlocked gun. In America, 1 out of 3 homes with children has a gun, and nearly 1.7 million children live in a home with a loaded, unlocked gun. And every year, thousands of kids are killed and injured as a result. The National Ask Day is a national effort to promote life-saving messages of asking. And while parents ask many questions about their children, where their children go to play, whose house they're going to be at, whether it's a friend or a relative, they seldom ask, is there an unlocked gun where my child plays? This week I will introduce a resolution in the Congress to designate June 21st as National Ask Day to help build awareness to ensure more parents think to ask this life-saving question. Accidents from unlocked guns remains an urgent problem, and too often accidental gun deaths result in the death of children. On average, in 2010, 1 child under the age of 15 died every 6 days due to unintentional discharge of a firearm. According to the Center for Disease Control's National Violent Death Reporting System, on average, 80% of these unintentional firearm deaths for children under 15 occur in a home. And clearly we have more work to do in order to ensure that guns are safely locked and kept out of the hands of young children. And this isn't a partisan issue. This is about keeping our kids safe, and Republicans and Democrats should be able to find common ground to protect our children from this type of horrific violence. We owe it to our kids to provide them with safe areas to play, free from gun violence and injury. Our children's safety is critical to shaping the future of our great country. National Ask Day promotes an important message, but we must do more to keep our commitments to keep children safe. Earlier this year, I introduced the End the Purchase of Firearms by Dangerous Individuals Act, which would ensure life-saving information is submitted to the Federal Bureau of Investigation's National Instant Criminal Background Check System to keep firearms away from individuals with a serious mental illness or who are in danger to themselves or to others. And while no one law or message will completely end gun violence, these are very pragmatic things we can do to help keep our communities and our children safe. So on this upcoming National Ask Day and every day after, I encourage parents to talk to their children and to other parents about the importance of gun safety, and to ask a very simple question. When your child is leaving your home to go to another child's home or a relative's home, ask, is there an unlocked gun in that place, so that you can be sure that your child remains safe. And so with that, I would like to now invite Mr. Donahue to come forward and share some words with us as well. Thank you.
My name is Frank Donahue. I'm the Executive Director of the Rhode Island Academy of Pediatrics. It's a chapter of the American Academy of Pediatrics. Ask Day is a collaboration between the American Academy of Pediatrics and the Center to Prevent Youth Violence. I'm sure many of you here today are aware of the appalling statistics that we have with children being shot accidentally. I won't go through the congressman that actually reported most of the statistics. They're shocking. In my own life, I had a friend who we were on our way to a canteen, a dance, and we were to meet at a certain place in Providence, and my friends didn't show up, 2 of them. I later found out that in getting ready for the dance, one of them was in the house, and just as a joke, took a shotgun and walked into the shower where the kid was taking, his friend was taking a shower, and said, "Put your hands up." And he said, "No, put the gun down." Pull the trigger, it was loaded, and threw him away. I mean, that was an astounding thing. And so, in my lifetime, I've been committed to try and keep guns under control. I'm not against guns, but I think they need to be monitored, and we need to keep better track of it, and we need to teach people about it. We need to teach parents that it's important for them to not let their children go into situations in which there can be unloaded, unprotected guns in the house, and accidents do happen, just like what happened to a friend of mine. The American Academy of Pediatrics is very much involved in this. We would like to educate all our pediatricians to teach parents to ask this question when they see them for preventive health visits. The Rhode Island chapter is composed of 300 pediatricians, and we intend to educate our pediatricians, not that they need it, but to remind them that when they're talking with parents about the children's safety, a very easy thing to do is just ask them that question. Ask. So I want to thank you for inviting us here. We're very committed to this effort, and we're very happy to be part of it here today. Thank you.
Thank you. I would now like to invite Karen Reed to come forward and share a very personal story. And bring yours.
Hi, how are you? I was very fortunate to be asked to speak here today, and mostly because we are among the lucky ones. These are my two boys. This is Jake and this is Jonathan. Jake is 11 and Jonathan is 8. On Christmas Eve of 2011, we visited the home of very close friends. This was definitely a place where we felt like we were completely and totally safe, and the ask never even occurred to me. The boys were tracking Santa on the computer on the NORAD site and came across what they thought was part of a video game accessory, which was in fact a loaded pellet gun. When you think about guns, you don't think about pellet guns and BB guns perhaps as being that serious, but in this case it definitely proved to be as serious and problematic as any other type of weapon. The boys found the gun. They were in typical boy curiosity, picked up the gun and were playing with it, and it did go off when Jake was holding it, and Jonathan was shot through the eye. As you can imagine, Christmas Eve took a very different turn as the ambulance arrived and we took our ride to the hospital, and I was spending my time praying for Jonathan's eyesight. After we were at the hospital for a couple of hours, I learned very quickly that instead of praying for his eyesight, I needed to pray for his life, because the bullet had actually traveled through his brain and was lodged there, along with some bone fragments and fragments of the pellet. So when the doctor told us that that was not something we could operate on, we were thinking about, well, what next? And after a week in intensive care and a month at home where Jonathan and I became very close, and now he doesn't like to leave my side, as you can see, in about half a year of PT and OT, he's doing great. We're very, very lucky. I think our emotional trauma certainly is a lot deeper than the physical wounds of Jonathan. He's probably doing better than the rest of us. Because the year of 2012 was definitely a sad, messy blur. It happened in 2011, but I'm talking about 2012. Thanks, Jonathan. That whole year was one of fear of the unknown, fear of not sure what was going to happen next, one of anxiety, one of worry, one of paranoia, and one of Jake spending a lot of time blaming himself, which was really, really heartbreaking. Because we know that this accident did not occur because of a 9-year-old boy's action, but rather that of an irresponsible adult. And my failure not to ask. I did not think of that. Now I ask. What's even nicer is that because of our friends and knowing that this has happened, they offer that information. Yes, would Jake like to come over to play? Oh, by the way, we don't have guns in our home. It's a really nice it's a nice consequence of that. But again, with all of the trauma and the chaos, we are definitely very much aware that we are the lucky ones, and we're very interested in helping kind of pay this forward and promoting this idea of asking. We would love it if asking became part of that normal routine when you're dropping off at a play date. Do your kids have any allergies? Are there any guns in the home? It's a normal conversation that can occur. We know that in this world we cannot keep our children safe by ourselves. It takes a group effort, and this is one of the things that we can do to make this happen. So let's work together to not only make it normal to ask, are there unlocked guns where my children play, but make it expected. If you do have a gun in the home, of course you need to keep it locked and safely away from children, and lock your ammunition separately. But everyone, regardless of how safe you are assuming this house is, ask, are there unlocked guns where my children play? Thank you.
Thank you, Karen. I mean, that I think says it better than anything anyone could say. And it's an example of the importance of having this conversation, even with family members and trusted friends, who it's not an insulting question. 1.7 million, I think, was the number of guns that are in homes, unlocked, where children are located. It's a huge risk. And so having this conversation, and this sort of is a national effort to encourage parents to ask that question, and for those who are receiving children into their home and play dates and friends of their children, not be insulted by this question, that it's a fair question, that if everyone asks, is there an unsecured gun in the home, we can prevent thousands and thousands of children from needless death or serious injury. So with that, I thank you all for being here, and thank all of our great advocates who are here, and happy to answer any questions.
I have a question. As my understanding, the CDC is not allowed to track this type of thing, and is there any move to maybe get the CDC on board with that?
There's actually legislation, and I'm a co-sponsor of it, to allow the Center for Disease Control to begin to collect data relating to gun injuries. As you probably know, there was legislation or an amendment that was introduced some years ago that prevent the CDC from collecting some of this data, which it's obviously a serious public health epidemic in this country, gun violence and the injuries relating to gun violence. But one of the important things we have to be able to do is to collect information around this issue. And though I don't have a great prospect that legislation will pass, there's legislation that's been introduced to allow the CDC to collect this kind of information.
Thank you.
Great. Thank you all.
Thank you.